outbreak of salmonella infections linked to organic sprouted chia powder. And so, for some of the background information, the problem mainly exists because people bought chia seed powder from brands that used a Canadian manufacturer called Bioessential Botanicals, and this chia powder was contaminated with salmonella, which triggered the actual outbreak of salmonella in the states. And the issues were that there were multiple strains of bacteria spread, and so these bacteria, since there's multiple strains, are a little bit harder to trace back, and it also can present in different symptoms in different people. So, as for some additional information, 16 US states were affected, and the distribution did occur internationally before the actual recall happened. And this occurred mainly due to the contamination of the dry seeds that were imported from Argentina to Canada, and a lack of a proper heat treating kill step, which kills any bacteria before the powder was created. As for demographics, there were about 94 people infected, and the age ranged from 1 to 81 years old, with the median age being on the higher side of 49 years old, and 62% of those affected were female. So, as for some analysis of the situation, some factors I want to consider: the economic implications of a recall, so the size of the actual market for the powder, as well as the cost of preventions in terms of what the company has to do to, sanitize, and consumer premiums, so how much are consumers willing to pay for those extra sanitizations. The cultural notions which kind of surround organic food being more healthy and therefore less able to be contaminated, which are associated with this chia seed powder. And then you also have vulnerable populations like the children and the elderly who are affected disproportionately due to a lack of proper immune response. There's also a lack of information about sprouted foods and the implication of the organic food halo kind of distributed throughout social media. And a higher socioeconomic group is affected since that's the main group buying these things. As for the SWOT analysis, so for strengths, we have multiple agencies collaborating like the FDA and the CDC. There was a pretty rapid product recall, and there was a lot of international cooperation since it did become an international issue. As for weaknesses, the supply chain is a little bit complex given it's an international supply chain. There were a lot of different strains of bacteria present. There's a lack of consumer knowledge about sprouted foods, and the powder itself has a long shelf life, and that can lead to delayed detection and people consuming it even after it's gone bad. As for opportunity, there's the increase of public education so that we can, bring awareness regarding sprouted food risks, and we can increase preventative measures when it comes to sprouted foods. And the threat is there's also a similar contamination process in other sprouted foods. There's risks when you're talking about international sourcing, and there's a potential antibiotic resistance in future outbreaks because the bacteria could evolve. So when we're talking about issue prioritization, the main issue is the contamination of the original imported seeds from Argentina, and this falls under FSMA compliance just because it was an international distributor, not a domestic distributor, and there's also complex supply chain just because that is an international supply chain. The contamination was amplified by the sprouting conditions, given they're moist and they're pretty high in temperature, so that's an environment where bacteria proliferate. And there was also a lack of heat treatment to properly kill the bacteria, a lack of testing before the product was sent out publicly, and there's also a lack of consumer education that kind of surrounds those sprouted organics. So those are things we can definitely improve on when we're considering the solutions. When we're analyzing alternatives, the first solution that we can see, there's a peracetic acid sanitizing solution, and this is a tested way to decrease the presence of salmonella in chia seeds and other, raw seeds, and it's comparable to other methods of treatment like dry heat and gas and other things like that, and it's actually shown pretty good reduction of these bacterias. And the second solution is warning label requirements. So this is like putting a warning label on the front of a product, and these labels can help interrupt those purchase habits by, drawing visual attention and increasing risk perception when reading these packaging. And then it also triggers an emotional response that makes consumers less likely to buy this thing or more cautious when they are using whatever product they're buying. So when we're talking about, the application of the health belief model for solution one, we're kind of, decreasing the individual susceptibility by actually increasing that sterilization. We're also, decreasing severity by decreasing the amount of bacteria that's actually in this powder. For the benefits, the public belief in the safety of sprout powder is increasing because they know that there's sanitization going on. So they're seeing that these benefits can come with this solution. The barrier is kind of, decreasing the burden on individual customers by, putting the burden actually on those companies who are doing it, the sanitization, and, this is kind of an external cue that's signaling individuals to be a little bit safer in their consumption, knowing that there's a sanitization going on. and individuals are also now more confident in their ability to safely consume any non-contaminated powder. As for solution number two, so the warning labels increase the awareness and of the disease itself and the severity by showing that it is possible, and it also the warning and the food safety signage kind of show the effectiveness of actually undergoing this warning label thing, and customers can see the benefit of following what's on the packaging. The information is also more easily accessible to overcome the barriers that customers can see, when they're consuming these products, because there's, direct safe usage signage showing like how to use this product or what to do to decrease the risk of contamination. And these easy instructions can increase self-efficacy through boosting confidence. So for the recommendations, the first recommendation is that peracetic acid sanitizing solution, where you would introduce the commercial solution through the FDA, and you would federally mandate this use in instances of sprouted products, and you would just spray this on, in this case, the raw chia seeds, and then you would sprout the seeds and grind them into powder as you would normally do. With the warning label requirements, you would kind of introduce these FDA-regulated warning labels for products containing sprouts, which talk about, the different risks that consumers can have when ingesting them. They include safe use instructions. This can be paired with like an FDA campaign, increasing consumer education about the risks of sprouts, and also you can target vulnerable populations on the label, so saying children or elderly or pregnant women are, at risk for this. Then when we're looking at the action plan, you want to have the FDA kind of define the standard operating procedures for this spray and implement those staff and education trainings for the operation that combine with those procedures, and you want to have them continue to monitor these facilities to make sure that the sanitization is actually happening in the way that it's meant to happen and make sure consumers are safe. As for the groups that are involved in the implementation, you have the employees who are at the distribution site who would actually be performing the sanitization. You have the FDA or the USDA who are implementing these procedures and also doing those safety and health inspections, and local and state health departments who are issuing permits and making sure businesses are up to local health codes and also are kind of helping with those inspections. As for the action plans, the first thing you would do is have the proposal and public comment of this new rule. So the FDA or the USDA would publish this proposed rule in a federal register, and the rule would be open to comment from, stakeholders, consumers, and public health groups, and this would take about 6 to 18 months. Then you want to finalize the rule, so you want to review all the submitted feedback from those previously mentioned groups, kind of adjust the policy for their concerns, and finally publish this rule. And then also you want to specify the effective date of this rule on companies. So usually it's about 30 to 60 days. It could be longer, like 2 months if it's 90 days if it's something that takes longer to implement. This will take about 6 to 12 months. And then you want to have the industry phase in compliance. So you want to grant those businesses grace periods to implement these changes, but you also want to decide compliance based on business size. So this takes about 1 to 3 years, with larger businesses tending to take smaller amounts of time, and smaller businesses taking longer amounts of time. Then you have the enforcement and audits. So you're inspecting and auditing facilities to make sure regulations are met. And this should be ongoing, so every 1 to 3 years by facility, just to make sure consumers are safe in the products they're consuming. As for the conclusion, so in 2011, there was a fenugreek sprout outbreak of E. coli in Germany, and this was linked to sprouts grown in Germany from imported Egyptian seeds. So it's kind of similar in terms of that international supply chain that we see, compared to this situation with, Argentinian suppliers to Canada and then back to the US. So in this scenario, they shut down the farm that was implicated in the growth, and then they banned the suspected seed loss and advised the public to either cook or destroy the contaminated raw sprouts to prevent infection. And as for a comparison, so these are slightly different approaches, where in Germany they actually banned the source of contamination, whereas in this one you're kind of understanding that there is that risk of contamination from those international suppliers, but you're mitigating that as much as you can by doing this sanitization step. And the Germany approach was also more public focused, since they were more advising the public on what to do, versus the proposed solution puts the burden more on the distributor by having the distributor be responsible for those sanitization steps. As for the opinion, so this case definitely presents a big problem with a lot of potential consequences, in terms of bacterial outbreaks, but the best way I feel to stop this problem was to kind of cut it off at the root and sanitize as much as possible in a pretty easy way, since the spray is a pretty easy thing to implement. So I feel like this was a pretty great choice to prevent further issues, and could be really effective in terms of, helping keep consumers safe. And these are the references.